Hi. In this series on learning about the prognosis or the scope of treatment for various diseases using homeopathy, today we'll talk about scope of treatment for ulcerative colitis and Crohn's disease. Both are related conditions. Ulcerative colitis is a serious autoimmune disease in which, due to certain immunological changes in the body, one develops large and multiple ulcers in the colon, and that leads to frequent loose motions with blood, with mucus, with painfulness, with difficulty in assimilation, loss of weight, and so many other symptoms. This is a chronic progressive disease, and it is very difficult to treat this condition. My name is Dr. Rajesh Shah. I am a director of Life Force, where we treat patients of chronic diseases including ulcerative colitis. My database says that we have documented over 1,000 cases of ulcerative colitis, and I am going to share with you some feedback and some notes about the prognosis of ulcerative colitis today. As I said, ulcerative colitis is a chronic progressive autoimmune disease. So essentially the treatment has to be addressed by correcting the autoimmune disease activity, which eventually leads to this ulcerative pathology. The treatment of ulcerative colitis in homeopathy is quite encouraging. I would say the results are good, but one has to know that the cases which are treated in the early phase of its development, they respond much better than those cases which approach homeopathic treatment in the later stages. In the early stages of, say, maybe 6 months to 1 year, if you are treating ulcerative colitis using homeopathy, one can expect a very good recovery. One can expect possibly a stage whereby we can go into what is called as remission. We can take this disease into remission, especially treated in the early cases. Once the patient is taking certain immunosuppressing medicines such as nilotinamide or corticosteroids, or eventually say cyclophosphamide, these are the strong, powerful immunosuppressants. And once the patient develops more and more dependency on these strong immunosuppressive medicines, then homeopathy has relatively more difficulties in treating this condition. That is what our experience says. Patients who are dependent on cyclophosphamide or such strong immunosuppression, they do not respond so well to homeopathy. And homeopathy may not be really indicated for those patients, but it is strongly advocated that a patient must approach for homeopathic treatment in the early stages of ulcerative colitis, just like any other chronic disease for that matter. Is it recommended? Yes, homeopathy is strongly recommended, especially in the early stages of ulcerative colitis and Crohn's disease. What is the duration of treatment? I would say the duration of treatment of ulcerative colitis is long, because conventionally the treatment is for many years, and likewise in homeopathy also one may look at taking the treatment for more than 2 years or longer. Of course, the results and the relief is observed in the initial 2 to 3 months in most of the cases, if not all. So I hope this video helps general public to understand more about the scope of homeopathy for the treatment of ulcerative colitis. This will help the profession as well as the lay people. Thank you very much.